very much, Harriet, for fitting a fantastic amount of information in a short space, and you can breathe now. Our next speaker is Jennifer Matjasko, and apologies if I got that wrong even after asking you, so I'm sorry for that. She's acting lead behavioral scientist in the Research and Evaluation branch in the Division of Violence Prevention at the US Centers for Disease Control and Prevention, where her research focuses on the development of at-risk adolescents and the factors that promote their health and well-being. So I'd like to invite Jennifer to speak. Thank you.
So thank you, Mark. And only about 5% of the people get my last name right. So you really beat the odds in that category. So first of all, I want to thank both Mark and Harriet for some great presentations so far. And I've been charged to follow up on Harriet's presentation and talk about the evidence base for violence prevention during youth and emerging adulthood. Now, summarizing the evidence base for violence prevention during adolescence and emerging adulthood requires an orientation to several issues and concepts. And this is the journey that I'm going to take you on over the next 20 minutes, and I will keep it to 20 minutes, I hope. First, I'm going to start by defining adolescence and emerging adulthood from a global perspective. And second, I'm going to provide an understanding of the universal developmental issues of this life stage. Third, I'm going to document the leading global threats to adolescent health. And I'm doing all this to preface the state of the evidence base for youth violence prevention, and I'll end by outlining the gaps in this evidence base. And before I go on, I just want to make it clear that for the purposes of this talk, I'm sticking with a strict definition of youth violence, and this is for the sake of time. And the definition includes acts of violence perpetrated by youth between the ages of 10 and 24, and I am excluding sexual violence, teen dating violence, intimate partner violence, and suicide from my consideration here. And other people will cover this later on as well. So before I launch into all of those things, I want to provide you with how I think about health. And generally, health is not just the absence of disease. Rather, health is a dynamic state of well-being characterized by a physical, mental, and social potential, which satisfies the demands of a life commensurate with age, culture, and personal responsibility. In essence, the precise characterization of health varies by age, and it is contextualized. So one example of how concepts need to be contextualized is in our definition of adolescence and emerging adulthood itself. What I've been charged to do with my 20 minutes here is to talk about the evidence around adolescence and emerging adulthood. And this is really a westernized concept. And it includes 3 stages during adolescence, including early, middle, and late adolescence. And it also includes a 4th stage known as emerging adulthood. Now, these phases are defined by a set of normative and shared experiences and transitions. And I just have some things listed here that falls under these normative transitions. But we need to be mindful that there are cultural variations in this definition, and that there are some cultures that actually don't formally recognize the adolescent period. And this is just one example here of how some societies define the different life stages. And you'll see we have childhood, puberty, and then the transition to adult roles. So oftentimes in some societies, there isn't a distinct time period known as adolescence. So despite the varying degrees to which cultures recognize adolescence as a distinct developmental period, I would say that the developmental tasks of adolescents are universal. And they include achieving emotional and behavioral autonomy, because becoming autonomous obviously will help us prepare for adult roles. They also include understanding one's emerging sexuality, as well as acquiring the interpersonal skills for dealing with romantic relationships. All of this will aid in mate selection and the transition to adult intimate relationships and marriage. Next, we hear a lot about identity issues during adolescence, and this process is really aided by the really newly acquired ability to think abstractly about who you are and who you'd like to be. So the process of identity exploration involves some reflection about one's values in different domains of life and how one behaves in congruence with their perceived identity and values. Finally, the last developmental task I have listed here is the need to acquire education and other experiences needed for adult work. So as you can see, All these tasks are necessary precursors for being a positive, productive, or in other words, a healthy adult, regardless of culture and context. And just like developmental tasks, I would argue that the developmental needs of adolescents and emerging adulthood are also universal. And they include positive social interaction with adults and peers. Now, these positive influences can be a sounding board for identity issues, and they also encourage a developmentally appropriate level of autonomy, as well as they encourage the development of prosocial interpersonal skills. Second, the need for structure and clear limits. Now, while I mentioned that autonomy is an important task of adolescence, the need for clear structure and limits never goes away, not even in adulthood. So it is very important for families and schools, as well as communities, to provide structure with clear limits on what is acceptable and unacceptable behavior. Also, within communities, it is important that there are opportunities for self-definition. For example, are there adequate community resources out there that provide the adolescents with opportunities for the identity exploration process? Also, within schools and families, adolescents have to have opportunities for meaningful participation in both contexts. So, for example, do they contribute to the household in meaningful ways and not just with chores? And are there opportunities for their voices to be heard in the school setting? Next is, here we go. Next is competence and achievement. And there are various avenues for competence and achievement, and education is obviously one of them. Arts and sports participation are others. The important thing here is that there are multiple opportunities for both during the adolescent period, because this aids in the identity exploration process and it also aids in acquiring the education and other experiences needed for adult work. Last are the needs for creative expression and physical activity. And we all need outlets for these things, but I would argue that it's particularly important for adolescents to have these opportunities because it does help aid in the identity exploration process, and it also helps us to understand what our values are. So now we have here the ecological framework, and it is useful in framing where the opportunities to meet these developmental needs of adolescents are. In other words, adolescents come of age in a particular community, school, and family. Now, individual characteristics, I would say, they drive the specific needs that you have for your social context. So individual characteristics like impulsivity can impact a person's emotional and behavioral development. And like I mentioned, the other levels of the social ecology also provide opportunities to either fulfill those developmental needs or they create deficits in meeting those needs. And at the family and relational level, they include things like structural characteristics, and one example is family structure. And they also include processes, like family processes that include parenting, as well as cohesion and warmth, as well as the quality and quantity of peer relationships, relationships with other adults, as well as the nature of romantic relationships during this time frame. And the same is true for schools. And schools ideally provide clear rules for behavior, and the teachers provide clear routines and structure for their classrooms. As far as community and societal conditions, they can also meet the universal developmental needs by having community residents who look out for children and youth in those communities, provide clear messages about what is acceptable and unacceptable behavior, and having community resources and organizations who can also provide this structure, all within the context of local, national, and national policies that help communicate about what the clear limits on behavior are. So up until this point, I have told you about the developmental tasks and needs of adolescents, and I have suggested that those needs and tasks are universal and consistent across different cultures and contexts. The other thing that is relatively universal during adolescence is that it is generally a healthy period of the life course characterized by low morbidity and mortality rates. Despite this, we know that violence disrupts the course of healthy development for far too many of our young people. And this is not just an American issue. This particular graph comes from the Gore et al. Lancet study. on the global burden of disease in young people aged 10 to 24. And what it shows is that violence ranks as the 5th leading cause of morbidity for youth between the ages of 10 and 24 as measured by disability-adjusted years. So given this, what can be done to prevent violence? And this is where the evidence base around what works to prevent violence comes in. And before I dive into this evidence base, there are a couple things worth mentioning. First, the evidence base for youth violence prevention is built primarily on rigorous evaluations conducted in the US or other high-resource countries, and this point has been made repeatedly throughout the day. Secondly, I'm going to discuss some general approaches, or like generic approaches, that have been shown to be effective in reducing youth violence among adolescents. One caveat to this is that there are specific programs within each of these general approaches that are not evidence-based, and that's why it's important to consult the registries and other resources that were talked about in other sessions in order to understand which programs have the evidence behind it. And when I present the evidence base, and when I talk about those general approaches, I'm going to link those to the universal developmental needs of adolescents and emerging adulthood. So let's dive in. The evidence base at the individual level is primarily composed of treatment-based, one-on-one prevention programs and therapeutic approaches. There she is. Okay, there we go. Generally, they're aimed at reducing maladaptive behaviors like aggression and violence and promoting prosocial behaviors. Now, most of the evidence-based programs in this area have generally shown a moderate impact on youth violence-related outcomes. And specific evidence-based approaches include cognitive behavioral therapy, life skills training programs, as well as multi-level programs that include individual approaches. Now, given that I've talked about general approaches, I just want to give examples under each level of the social ecology of an evidence-based approach. And I want to use multisystemic therapy here as that example, and it's something that Mark talked about as well. So MST, it's also known as MST, and it addresses multiple factors known to be related to delinquency across the key settings or systems in which the individual is embedded. So it really takes an ecological approach. And what it does is that it strives to promote behavior change in the youth's natural environment in order to build up the strengths in that environment to facilitate change in the individual. And one of the major goals of MST is to empower youth to cope with family, peer, school, and neighborhood problems. So that's just one example of an individual level approach. But in terms of the developmental needs addressed across the spectrum of individual level approaches, they include, but are not necessarily limited to, the ones highlighted here. And specifically, by reducing maladaptive behaviors and promoting positive interactions, they encourage positive interaction with adults and peers. In addition, it's important to note that some forms of cognitive behavioral therapy promote healthy physical activity and creative expression, so that's why those are highlighted there. And through these positive prosocial experiences, the programs have been shown to increase competence and meaningful participation in families and schools. Now on to the family and relational levels. And it's really composed of a range of approaches, and they include family-based interventions, parenting skill programs, and programs that foster prosocial relationships with individuals outside of the family. They're generally aimed at improving functional family processes, improving parenting skills, and fostering prosocial relationships with peers and adults. And according to some of the reviews out there, most of the evidence-based programs at this level have shown a moderate impact on youth violence-related outcomes. And some of the specific evidence-based approaches include family support and parenting education early in life, so similar to some of the programs that Harriet talked about. And they also include a host of programs implemented during the adolescent period. And they include parenting education and parenting skills programs, as well as structured mentoring programs, brief family therapeutic approaches, as well as multi-level programs that include structured mentoring. In terms of the specific example of an evidence-based program at this level, I'm going to talk about brief strategic family therapy, or BSFT. And it is a short-term, problem-focused intervention with an emphasis on modifying maladaptive patterns of interaction. BSFT works to transform any maladaptive interactional patterns into more functional ones. So that's just one example of an evidence-based program at this level, but based on the host of strategies that I mentioned, the developmental needs addressed by approaches at this level is composed of the ones highlighted here. And as the description of BSFT nicely illustrates, many of the programs aim to change relational processes so that they are healthy and adaptive. Thus, they encourage positive interaction with adults and peers. Also, many of the family-based programs work with families to provide structure and clear limits for the adolescent. And by fostering more functional family processes, this allows for the adolescent to engage in a meaningful way with families. Finally, most of the evidence-based mentoring programs aim to establish prosocial relationships with adults from the communities, and those mentors may introduce the adolescents to opportunities for self-definition within those communities. Next is the evidence base at the school level, and it's really composed of a wide range of interventions with the unifying theme is that they are implemented within the school system. Generally, they are aimed at reducing student misbehavior, improving teacher management of behavior, and improving school climate. Now, most of the evidence-based programs in this area have been shown to have a moderate to strong effect on youth violence-related outcomes. And the list of programs are here, and they include a wide range of things, including things implemented during the preschool period and the elementary school years, as well as programs implemented during adolescence. And then just to give you an example of one of the evidence-based programs in this category, it includes the Gang Resistance Education and Training Program, or GREAT. And GREAT aims to provide skills to eliminate delinquency and youth violence, as well as gang membership. And the program is conducted within the school setting, but it is facilitated with law enforcement personnel, so it's a nice partnership between the school setting and law enforcement. And it's designed to encourage students to make healthy choices to be involved with prosocial activities and not delinquent ones. In terms of the developmental needs addressed at this level, they include but they're not limited to the ones highlighted here. And as the description of GREAT highlights, many of the programs aim to encourage relationships with prosocial peers and adults. And many of the school-based programs also provide teachers with training on how to provide structure and clear limits so that classrooms are more manageable. And because programs address student misbehavior and classroom management, there may be great opportunities for meaningful participation within these schools and for ways to encourage adolescent competence and achievement within the school environment. Next is the evidence base at the community and societal level, and it's composed of community level strategies and policies at the local, state, and national levels. Generally, they are aimed at improving community conditions or affecting social change and norms. Now, this area of research, as it applies to youth violence prevention, is really in its early stages with fewer rigorously tested interventions at this level. Because of this, it is important to note that the rigor of the evidence base is different than for other levels of the social ecology, so the ones that I'm going to mention can be characterized as promising. And they include alcohol policies limiting access to alcohol, business improvement districts, built environment or crime prevention through environmental design, and I also have prevention planning operating systems listed up here. So one example are the BIDs. And what BIDs are is that they are grassroots self-organizing public-private organizations. And what they do is that they provide economic development opportunities within communities. And they have been shown to have an impact on homicide reduction in Los Angeles. And in particular, it's important how BIDs spend their resources. And those that spent them on private security and sanitation showed the largest share of homicide reduction in that case. So in terms of the developmental needs addressed at this level, you'll notice that they're relatively fewer compared to those at the other levels of the social ecology, but the appeal of strategies at this level is that they have the capacity to reach a larger number of individuals. And a couple of developmental needs are highlighted here, and they include physical activity, because a lot of the built environment approaches really focus on the provision of green space and parks, and that might encourage community residents to go out and get active. And also by improving community conditions, there are increased chances to find opportunities for self-definition within communities. So I would say strategies at this level are critical in meeting this particular developmental need. So, to sum up, even after 25 plus years of research, there are obviously still gaps that remain in the evidence base for youth violence prevention. First, it's around emerging adulthood. Most of the research in this area has focused on youth up to age 18, so we know much less about what works to prevent violence during emerging adulthood. Second, there are huge questions in the field about the necessity and effectiveness of cultural adaptations to evidence-based interventions. Certainly, language adaptations are necessary, and there is ongoing work that is examining whether cultural adaptations improve the effectiveness of evidence-based interventions, and so far the evidence is mixed for this. Third, given that most of this work has occurred in the US or other high-resource English-speaking countries, it is difficult to know the extent to which this evidence translates into less developed countries where there are key differences in infrastructure. And one of the key questions here is the prevention delivery systems available in other countries. A lot of the prevention research here is focused on schools because that is one of the best ways we have to reach youth in this country, but the schools and the systems in other countries may not be comparable. So there is a need to leverage the translational work in other areas like HIV prevention in order to understand how evidence-based interventions need to be adapted so that they can be implemented globally. Finally, the field of implementation science around youth violence prevention is burgeoning. We now have a host of evidence-based interventions that we know work with specific populations under specific conditions. The question is, how do we effectively bring these programs to scale, and how do we sustain these efforts within communities? And those are just a handful of gaps that I wanted to mention, but I wanted to conclude by making a few statements and a few calls to action. First, it is important for youth violence prevention programs to meet the unique developmental needs of adolescents and emerging adults. I highlighted ways in which individual needs vary and how families, adults, peers, schools, and communities can be supported to meet those needs. We also have a solid evidence base at the individual, relational, and school levels about effective ways to meet those needs, yet we need to know more about what works at the community and societal levels. And we also need to understand how evidence-based youth violence programs can be implemented and evaluated in other countries with varied resources and delivery systems. And related to this, we need to rigorously evaluate these adaptations to make sure that they are working as intended within these diverse contexts so that adolescents and emerging adults worldwide are healthy and fulfilling their potential. With that, I just wanted to thank you and some of my colleagues at the CDC who helped with this presentation.